Good morning, everybody. We're going to go ahead and start today's meeting. It's Tuesday, October 26, 2021. It's 9:30. Erica, could we have roll call, please?
Commissioner Henry.
Here.
Commissioner Tedesco.
Here.
Commissioner Pinter.
Here.
Commissioner Odoricio.
Here.
Commissioner Baca.
Here. Okay, if we could stand and say the Pledge of Allegiance, please. I pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all. Can I have a motion to approve the agenda, please? Do I have a second? All right, next is awards and presentation, and there isn't any. Next is public comment. Erica, do we have anyone signed up today?
We do have 4 people signed up today.
Okay, if you could say the first person, please.
Trevor Steen.
Oh, way cute. What a way to persuade us. That is just so wrong.
We'll see if she cooperates. We may cut this short. I do have 3 topics today. I don't know if I get 3 minutes per topic, but I'll
No,
roll through
just
this.
3 minutes total.
3 minutes total. All right, we're going to run fast then. My name is Trevor Steen. I live at 11093 Pitkin Street. I'm here for 3 topics. I want to talk about the disaster management plan that's on the agenda, the Tri-County Health Department withdrawal, and a Colorado Open Records Act request denial. For the disaster management plan, reading through the plan, it looks like a solid plan. Certainly, I'm sure you have experts who have developed that plan. What I'm concerned about is the lack of planning around cybersecurity incidents. I'm not a risk management expert or a disaster expert, but I am a cybersecurity expert, which does involve a significant amount of risk mitigation and disaster recovery work. I'm concerned that in the plan, it says that cybersecurity incidents are expected to have limited geographic impact, limited severity, and low overall significance. Just in the past year or so, in February, there was a cyber attack in Florida that impacted the water system for 15,000 residents. In 2019, 22 Texas towns were hit with ransomware attacks. And this month, there's a lawsuit alleging that back in January, a cyber attack caused the death of a baby in an Alabama hospital. These events highlight that the attacks are real, and the public is going to look to the county for support in those situations, even if they're not something like a natural disaster. With that in mind, I just ask that the board look at that plan, make sure that we've planned appropriately for cybersecurity incidents. Also, that plan talks about Tri-County Health Department and their involvement in the plan, and obviously later today you're talking about whether or not we should withdraw from them, so I do want to make sure we plan for that. On that note, the Tri-County Health Department withdrawal conversation today, I'm not sure that I'm the kind of person who has the knowledge to decide whether or not that is the right decision from a budgetary, resource, or staffing perspective, but I will say we should make that decision based on more than just mask mandates and political fear-mongering. The Tri-County Health Department supports birth and death certificates, data collection, trend analysis and mapping, emergency and disaster response action, and also parent and child health, including WIC, childhood screening services, and pregnancy services, all of those which have shown to significantly improve community living standards when provided to the community. So I just ask that we not use the myopic view of mask mandates and political fear-mongering to make a decision as to whether or not we should leave Tri-County Health. Lastly, the topic of indemnification. I spoke to the board maybe about a month ago on this topic, that the board indemnifies county employees who have performed their duties per their job description, and the county is going to indemnify them against any damages. To look into that a little bit more, I did submit a Colorado Open Record request on October 18th for the investigation regarding Chris Laws and Jason Spillis. The response from the Assistant County Attorney, Meredith Van Horn, was that, quote, Adams County has no public records responsive to this request. Is it honestly true that these investigations are not documented in any way? I'm concerned as a citizen that we have no way to see how those investigations played out, how they were conducted, or what the result was. So I do ask the board to take further look into that to see if there's a way that the public can be more, or that process can be more transparent for the public. Thank you.
Thank you, and good job. And she held it out.
She did.
All right, Erica.
Libby Moorish.
Libby?
Way that I could put this transparent up on the board.
Okay, well then I'll just read it off, okay? Hi, my name is Libby Morrish, and I'm a resident of Adams County. I pulled this directly off of the CDC website, okay? The COVID-19 survival rate by age group, 0 to 19, 99.997% survival rate. 20 to 49, 99.98% survival rate. 50 to 69, 99.5% survival rate. 70 plus, 94.6% survival rate. Why is Tri-County pushing masks, testing, and eventually the vaccine if these statistics are correct? I'd like to be taken out of the Tri-County state because they're not telling the truth. So, and if you would like this documentation, I've brought it with me, and I'll be glad to give each one of you a copy. All right, thank you.
Thank you. Erica?
John Douglas.
So, good morning, Commissioners. I'm Dr. John Douglas, Executive Director of Tri-County, and I wanted to make a few remarks regarding this morning's resolution. First, I'd like to thank Tri-County staff, community partners, residents, and elected officials going back 73 years since Adams County joined with Arapahoe and Jefferson to create Tri-County in 1948 for being such an effective regional public health collaboration. Second, realizing we do have masks in schools, but if you'll forgive me. Second, realizing the board has spent much time considering how best to proceed, including your support of the report provided by the Ottawa Group consultants. As you make this decision today, I want to be sure you understand Tri-County's perspective. We know the past few years have presented lots of challenges for the governance of a three-county health department, most recently resulting in the decision of Douglas to withdraw. However, we think maintaining a district health department collaboration with one of the other original co-founders of Tri-County, Arapahoe County, has important advantages that make establishing a new governance structure with them worthwhile. First, as you know, the size of our organization has created not only budgetary efficiencies, but also staff expertise unique for a local health department. Not only does this expertise enhance strength and diversity of our programs, they also provide greater bandwidth for procuring additional resources through competitive grants and contracts. One of the reasons for every dollar the county spends on public health, we've been able to leverage $4 of additional resources. The COVID pandemic is unfortunately not over, but we're already leveraging lessons learned from our response. One of the most important is the critical importance of ongoing partnerships, particularly with community-based organizations. These have been growing over the last year and complementing those previously developed with schools and hospitals. And then finally, some of these advantages, such as expertise and partnerships, can certainly be rebuilt by a new health department over time, but likely with a price paid in terms of lost momentum and hence near-term opportunities to improve health outcomes for our residents. We think building on these advantages by maintaining a multi-county health department can create an even stronger public health system for the whole county, as well as the cities where most residents live, and maybe especially for the city of Aurora. Finally, while we welcome continued dialogue about the future of public health, regardless of your decision, I want to be clear that Tri-County is committed to working with both counties to assure as seamless a transition as possible to whatever new future structure is developed. In making this commitment, as for my remarks in general, I'm channeling the dedicated staff of Tri-County who will remain as mission-driven as they and their predecessors have been for 73 years. Thank you.
Thank you. Okay, Erica?
Paulina Romano.
Paulina?
Good morning. Even as efforts should be made to encourage populations to get vaccinated, it should be done so with humility and respect. Stigmatizing populations can do more harm than good. Importantly, other than non-pharmacological prevention efforts, the importance of basic public health hygiene needs to be renewed in order to strike the balance of learning to live with COVID-19 in the same manner we continue to live 100 years later with various seasonal alterations of the 1918 influenza virus. That is a quote from the National Center for Biotechnology Information, the National Medicine Library, and the National Institute of Health. Mandating mask wearing, vaccination, and social distancing is stigmatizing and promotes segregation. Segregation is the act or state of setting someone or something apart from other people. My children don't care if their friends or new people they meet are masked, unmasked, vaccinated, because my husband and I have instilled a level of respect in them from birth. Furthermore, we have never thought to ask those around us about the medical care they choose to receive. It is simply none of their business, and when we feel like we need to take extra precautions, we do just that. My children, however, have been outcasted by others, ignored by kids their own age at the playground for being unmasked. My children don't understand why, in those moments, that they have had to feel rejection at such a young age. We are inflicting so much emotional turmoil on these kids, and for what? The efficacy of masks and vaccines has been questioned and changed countless times. There is a new scapegoat every time we come before you and ask, when and where does this end? No one is taking responsibility. Dr. John Douglas's true colors have come to light. He imposed those mandates to satisfy feelings. We don't need people to work off of feeling and emotion. We need people who are going to work off of facts. And the facts are, mandates have no place here, and we will not stop until they are lifted. Mandates are not law, and those of us who care about our rights and freedoms more than the mandated convenience will not stop. Those who stand for nothing will fall for everything, and I continue to stand.
Thank you. Do you have anyone else, Erica?
That was everyone signed up.
Okay, is there anyone in the audience that would like to speak that did not sign up? If you want to come down, state your name, please.
Yes, is it okay if I look off of my computer while I read off of my computer?
Yeah, you can read off your computer. Trust me, I do it all the time. I'm old. Memorizing just isn't my thing.
Thank you so much for inviting me to speak. My name is Carrie Lee Ryan Hansen, and I'm here solely on the behalf of myself. Sorry, I get nervous. Just going to take a couple breaths. I am a public health nurse. So I'm not at all here as a representative of Tri-County Health Department, but just here as a public health nurse. I understand that Adams County Commissioners made the decision to withdraw from Tri-County Health Department with the residents of Adams County in mind. And I'm here today to express my concern regarding the possible impact of this withdrawal on Adams County residents, especially the most vulnerable families and individuals that have trusted Tri-County Health Department services for generations. Public health can be a mystery to a lot of people, including myself at times. How do I explain my role to people? Health educator, health navigator, case manager, family advocate, someone who listens. I'm very thankful to have had the opportunity to work with Adams County families as a nurse home visitor at Tri-County Health Department for 4.5 years. During this time, I've heard from my clients more than once something like, "You've been the only one that has helped me." Receiving this kind of feedback brings many different kinds of reflections. Of course, it contributes to my sense that I'm doing meaningful work. And I know that many, if not all, of the Tri-County Health Department employees have heard something to this effect. A big part of public health is bringing services to people rather than asking people to come to the services. While I am passionate and dedicated to the work I do, I know that it would not be possible for me to support families in the way that I do without the community collaboration, partnerships, and leadership that Tri-County Health Department has built over years and generations. I know some folks have dedicated large parts of their careers to making my ability to support families possible. Building trust and partnerships that make public health possible requires consistency and a lot of time. I feel troubled that the withdrawal from the Tri-County Health Department could significantly interrupt access to needed public health services for Adams County residents. And I wonder how long it would take to rebuild the kind of partnerships and trust with the community that Tri-County has cultivated. There are a lot of examples that I can give in terms of how I collaborate with the partnerships within Tri-County Health Department. If I meet a family, for example, whose circumstances are that they do not have internet, transportation, a working phone, a safe, stable support system, or access to their own physical or mental health needs, I can easily contact many of the kinds of programs that Tri-County houses, such as WIC. I can contact Vital Records to help the families navigate how to get needed records, that our health enrollment team to get them connected to Medicaid, and all of this can happen really quickly.
And I got to ask you, because you're over your 3 minutes, if you could just
Oh,
kind of
okay,
wrap
sorry.
it up. Yeah, no,
Yeah,
you're
thank
fine.
you so much for hearing me.
No, thank you. We really appreciate it. Okay, is there anyone else in the audience if you would like to come down? I swear he changes every week.
He does. He's
Yes.
7 months old today. I'm back again. So again, I wasn't going to talk today, but felt compelled to. Again, as you guys know, I'm a pediatric ICU nurse for over 12 years, unvaccinated, on the brink of possibly losing my job because of it. I know Dr. Douglas is here trying to redeem himself as well, because his job is also on the line if we leave Tri-County Health. And I, again, applaud you guys for putting that on the agenda and bringing it towards the Adams County residents today, because we deserve this and we deserve change, because what has been happening hasn't been working. Again, like I said, I've taken care of multiple children throughout my 12 years. I had a baby during the pandemic. I'm not vaccinated. My kids are forced to wear masks over a mandate created by Dr. Douglas, in part with Chris at the Cherry Creek School District, between Cora responses that we've received that prove different correspondences between the two that basically asked Chris at Cherry Creek Schools to if Dr. Douglas would appease him into making mask mandates just to make his people happy. And so we're finding these things out, and again, as we're here week by week, we're still not happy. Again, like I said, I am happy that this is finally on the agenda. We're having this opportunity to leave such a corrupt county health department. It's not doing anything for the Adams County residents, except masking our kids and causing my kids personally to come home with bloody noses every week, dirty masks and sicknesses. Again, like I said, I'm on the brink of losing my job because I won't vaccinate myself. I won't vaccinate my children with the COVID-19 vaccine. And so I understand Dr. Douglas's plea in being here and trying to save his job, because mine's also on the line. However, my children are much more important than any other job, taking care of other people's sick kids, and I'm willing to let that go. But again, like I said, I just am compelled to be here today and again raise my voice and chat with you guys again and bring my baby and just be here to support you guys in moving forward and leaving Tri-County Health, and we appreciate you guys talking about it today.
Thank you. Is there anyone else that would like to speak? Okay, I don't see anyone else. And before we move further, there was a couple of topics that were brought up I'd like to have maybe someone answer. One of them was in regards to the core request. County Attorney, can you explain that?
Sure. So commissioners, the investigation that's done when lawsuits are filed in order to determine whether employees were acting within the course and scope of their employment is done by the county attorney's office. And so those investigations would be attorney work product and or privileged, and that is why there is no actual file or investigation that is a public record.
Okay, thank you. And then is there someone that can answer the concern about the cybersecurity? Great. Come on down. Come on down. Feel like the price is right.
Good morning. I'm Ron Sigmund. I'm the emergency manager for Adams County. The piece of the document, the disaster management plan that was referenced, is our hazard assessment and risk analysis. We recognize that cybersecurity is a hazard and a threat for Adams County. It was just recently added to our 2020 hazard mitigation plan, which covers that particular hazard more in depth. In addition, we have a cybersecurity response plan that is maintained through our cybersecurity analysts up in the IT department that covers it more in depth. The reason that it was scored the way it is because the definitions given to us by FEMA that allows us to rank those places cybersecurity in those categories. So those are based on things like geographic location, probability of future occurrence, magnitude, severity, and significance. So we look at the overall county. Most of the cybersecurity events that we've had or that we've experienced are contained to either individual agencies or a small geographic area. In other words, they don't impact the entire county, which would be more severe. That would boost that up into a category. These aren't set in stone. They can always be adjusted. So if we find that we're having cybersecurity attacks, which we do every day, we know that, but do they impact the entire county? And the answer that we found through our consultant who helped us with the hazard mitigation plan is no, they don't. They're normally restricted to a smaller part of the county. And that's why it's scored the way it is. If we find that that needs to be adjusted, we can always do that.
Thank you. Okay, now we'll go on to elected officials communications. Commissioners, do you have any comments? I got a feeling our comments are for later, because I know you all have comments. All right, great. Next is consent calendar. Can I have a motion to approve?
Move to approve, Madam Chair.
Do I have a second?
Second.
Did everybody? Okay, there it is, passed, great. All right, next is new business. County Manager, what do you have for us?
Good morning, Commissioners. The first item is the resolution before you is to provide notice to Arapahoe County and Tri-County Health that the board has decided to withdraw from the Tri-County Health Department. That is the first resolution before you.
Not giving us a breather, are you? All right, I know commissioners have comments, so.
I'll start.
Commissioner Odoricio.
Thank you. Appreciate everyone coming in. Dr. Douglas, thank you for coming in and sharing the background and the history and some of the facts about the hardworking folks at Tri-County Health. I think I'm going to support this resolution, and in no way is this a knock against the folks working at Tri-County Health. In fact, I would like for us to commend the folks that worked at Tri-County Health, not just during the pandemic, but especially during the pandemic and before. I'm going to support this because I think if you look at it, Adams County has a history of consistently out of the Tri-County Health and other areas in the metro area of not necessarily having the same or as good public health outcomes as other communities. When Douglas County and other counties are ranked higher consistently when it comes to public health outcomes, and we're in the same organization, it means that the status quo cannot continue. Specifically, we have some unique challenges in Adams County. We have challenges around pollution and poverty and placemaking. Pollution, we are the hub of all the highways. We have manufacturing, logistics. We have some landfills, and we have we have the only refinery in the state, Suncor. That means we have unique challenges that we need to address that impact public health. Poverty, we are constantly trying to work to help elevate the economic outcomes for some of our people, but that also means that the poverty and economics does contribute to the challenges and the social determinants of health. And then, of course, we get down to places and placemaking. We have food deserts. We have to improve some of our safety when it comes to active living in these locations. These are areas that a lot of folks in the metro area have, but I think that we have such unique challenges that it's okay for us to set a new path and a new course for us. These things that I discussed above impact our mortality rates and those social determinants of health. With that said, today is just, I look at this as notice, a notice to set a new path. We're going to have a transition for 14 months, and it's during that time where we must commit ourselves to maximize opportunities for synergies and savings. We must focus on improving safety, public health outcomes. So it's with those reasons that I'm going to be supporting this resolution today.
Thank you. Any other commissioners? Commissioner Baca?
Thank you, Chair. I want to start my remarks today to recognize the organization of Tri-County Health, their leadership, and the staff. Understanding that public service is a calling, and we are grateful for your service to the county of Adams, Arapahoe, and Douglas, and for your continued service through this transition, if the board chooses to vote on that today. The decision for me today, we've undertaken this, new commissioners starting in January of this year. The decision for me today includes the historic undertaking of Tri-County Health, the history of Adams County. This is a health department that we've known in the history of Adams County. And today we have an opportunity to prioritize public health for the residents, the partners, the community, Tri-County Health staff, the leadership of Adams County to take on a new priority for public health here in Adams County. It became apparent through the time of the Ottawa Group presentation. The board has been meeting about this for several months since the beginning of the summer. And I want to give a little bit of context of what the board heard, because I think what we're hearing from the public, at least what I've been seeing on social media and some that have reached out to me, is that this decision has been done hastily and without any sort of context or research, and that simply is not the case. The Ottawa Group, Adams and Arapahoe County, have taken under a study for several months since the beginning of the summer. They were not a recommending board, rather a research board to bring back information regarding public health. We involved community leaders, mayors, our stakeholders, community partners in Tri-County Health to be involved in this transitional effort. Two models were specifically looked at for the Ottawa Group. The model that the counties go their own, standing up their own health department. The second model was the counties of Arapahoe and Adams continue along with Tri-County Health. In the end, it was apparent to me that it was the shared governance of the counties that became the biggest challenge. And I don't take that lightly. I think that that is probably one of the most determining factors for me today. There is no other way other than to provide notice to Tri-County Health and to continue the conversations with Adams County, the Board of County Commissioners, our health board members, leaders in this community, community partners, and our residents going forward on what public health means to Adams County. This is an opportunity for items to be addressed that were stated by my fellow County Commissioner Steve Odorizio that I won't repeat here. Another deciding factor for me is that within the next 20 years, Adams County is anticipated to add nearly 250,000 additional residents. I've been in public service long enough to know, to look back and say, people that have served prior to me had missed an opportunity. And I think that today, we have an opportunity, again, to prioritize public health in Adams County. Public health dovetails into everything that we touch here in Adams County, whether that is planning, that is even our hazardous mitigation plan that was discussed earlier, food deserts, poverty, housing, mental health, and behavioral health services. So I, as well, will be supporting that Adams County give notice today to Tri-County Health and Arapahoe County so that we can pursue the conversations here in Adams County for the best public health service and to start a new chapter in public health for Adams County.
Thank you, Commissioner. Any other commissioners? Commissioner Pincher?
Thank you, and thank you to my colleagues who have taken the time to speak and very well stated. I feel that there's a lot that needs to be said here, especially when you're talking about the further dissolution of a relationship that's been going on for over 70 years. And that's a relationship with our neighbor counties, as well as the Tri-County Health Department. I have to push back quite vigorously against this accusation that any of these public health workers, Dr. Douglas or any of their staff, are corrupt. I've had the privilege of being the liaison from this board to the health department, and I can tell you they have given up their nights, their weekends, their rest, their comfort to serve our communities. They have shown up to work in the face of firebombing threats, death threats, personal doxing, and generalized attacks. They have been on the phone with people helping with contact tracing and have that person scream at them, threaten their lives, and yet continue to help that person access services. So, Dr. Douglas, I'm so glad you're here. I know that you have a long and distinguished career in public health, have literally dedicated your life, all of your work pursuits and your personal pursuits to doing the best you can for our community. And I know that you are the head of an agency that does the same, and that you have workers all up and down from the entry level to your executive leadership team who have sacrificed so very much. And I know they are tired. I know they are tired because I know they have worked tirelessly for our community, often without a warm welcome, often having to deliver bad news. We have asked you to carry all of our bad news and all of our disappointments for the past year and a half, and you have done it with grace, determination, compassion, and a real commitment to serving the community no matter what was thrown at you. And so for those of you who can't see that, I would encourage you to really listen to anything, any of the work that Tri-County has done and any of their public town halls that they have done. The compassion is truly overwhelming. I have been, it's probably not a surprise, the commissioner who has wrestled the most with this decision to leave Tri-County Health Department. I walked in this morning, as you know, we're always supposed to do, but really truly unsure of whether or not this is the right decision. Because I know how deeply the workers at Tri-County have given their expertise, their time, and their talent to our community. Commissioner Baca is correct on the context that we asked for community feedback. We will continue to ask for community feedback. It is important to continue to hear from the public on what's important to you. As we have a health department that will be serving exclusively Adams County moving forward. Is that maternal health? We've got a lot of parents in the room. Is that asthma rates? Is it heart disease? Is it mental health? Is it suicide? Is it pandemic response? What is it that is of concern to you? We have a lot of data that tells us that these things are probably at the top of your list, but we know that's not everything that worries you. We also want to emphasize, and I want to specifically emphasize, that this is truly a one-year notice. Tri-County Health is our health department. They will remain our health department for the next year. We will need to treat that relationship very thoughtfully because they are working very hard to protect us, despite the fact that we have told them we don't want to work with them anymore. And that is an incredible grace and dedication to service that I cannot thank John Douglas, and all of your team enough for your continued dedication as Tri-County itself dissolves. This decision will be an increased cost. There are some estimates that this could double our costs. There are also some estimates that we're headed this way anyway because of our population growth, and we need to have enough staff to respond to our county. But the opportunity that my colleagues insist that this offers to us is the ability to make sure that our health department puts science first, our health department puts our residents' health and well-being first, and that we continue to have professional and high-quality care, as we have seen. And we would be so lucky to have the caliber of individuals who have been representing us at Tri-County continue to represent us as we move forward.
Thank you, Commissioner. Any other comments? Commissioner Tedesco. You want to put your mic on now? There you are.
So this is a tough decision today. I know what Tri-County means to Adams County. I know the services that they provide to Adams County. I know there's probably some services I don't know that they provide to Adams County. What's disconcerting for me, though, is the lack of people taking accountability for how we got here. What's disconcerting to me is the ability for people to, in lack of better words, use scare tactics, go to the press, spread misinformation, half-truths about how we got here. That's disconcerting to me. When we ask for information about accountability of monies that we have consistently invested and increased over the presentations that we have received as Adams County Commissioners, and yet still not adequately understood how those monies are utilized within our county. The monies are put into a giant pot. Then Tri-County decides how they want to spread that money out through all their services. But in nowhere in any of those presentations did I see the amount of monies that we have spent in Adams County to Tri-County and what return we got on that and how much of those monies were spent in Adams County. We've been told about services. We've been told about how much those services cost. But there is no real accurate accountability for monies spent in Adams County that we have provided to Tri-County. Of course, this is my opinion. I don't speak on behalf of the board. I do not have a medical degree. But what I will tell you is that when it comes to accountability, I'll stand here in front of you, or sit here in front of you right now, and I'll take accountability for where we are right now. I will admit to you that we have been in this process for years. This isn't something that has come up in 6 months. This isn't something that we've been dealing with in 2021. These are issues that have come up to us consistently throughout the years, and it's through governance. It is through the ability to placate to the loudest voice and not have any real accountability as to service and the way that service is provided. That's my concern here. To the employees of Tri-County Health, I want to apologize to you for being in this position. You are some of the hardest working people out there. Your services are bar none, probably the best in the state. But it is because of information not being portrayed accurately or conveyed accurately that we're in this position that we're in today. I have real concerns about how we're going to do this. I have concerns that we are are going down a road that could put some services at risk or even missed. But even with all of that being said, change is hard. Our decisions here on this dais are hard. We are citizens of the county just as you are. I have family, I have friends, I have those that utilize Tri-County services, and I do not want them to be left in the cold, literally. But I will take accountability for how we got here. I will also tell you that I will work my hardest to make sure that we do not leave anybody behind. To the employees of Tri-County Health Department, please stay with your Tri-County Health Department. Yes, changes are coming, but stay there. There are opportunities. This doesn't mean that Tri-County Health dissolves. It may just mean that there is a different avenue for us to continue. And really, the concern for me is not with the services and the people that are providing it, but how our relationship in governance is attained. So that being said, please stick with your Tri-County Health Department. This is going to be a difficult and long conversation over the next year. But again, we're not out there to try to harm anyone, whether it be the employees of Tri-County Health or any of the residents in Douglas, Arapahoe, or Adams County. We're going to do our best. Thank you.
Thank you, Commissioner. And as the commissioners were speaking, I noticed our mayor from Aurora has come into the auditorium. So thank you, Mayor Kaufman. And I'm going to give him, since he missed our public comment, because this topic is so important and it does affect his city, I want to give him the privilege to come forward and speak for 3 minutes in regards to this.
Thank you, Commissioners. I'm sorry we went till 1 in the morning in a council meeting last night. Welcome to local government. First of all, I want to say that what a great partnership we have had with the City of Aurora has had with Adams County. You are really the future of our growth. When we look forward, it is our partnership with you. It's commercial, it's residential development, and now what is Northeast Aurora, which is all Adams County. And so we have enjoyed a great relationship. Tri-County has been our healthcare provider, a public healthcare provider, and we sit in 3 counties, mostly right now in Arapahoe County, although, again, I stated our future growth is in Adams County. We have a small piece in Douglas County, but it's all residential. There's not a commercial component to that. And so, obviously, this decision is very important to us. I just want to say that we've had a great working relationship with Tri-County Health in navigating us through some of the most difficult times historically. And it is so easy, and I'm guilty of it as so many other people, to sit back and second guess so many of their decisions. But these were hard decisions, navigating in unknown territory. And these were decisions, thankfully, I didn't have to make. And I can't say enough about how they reached out to us and made themselves accessible. I was on a meeting with you, on a weekly meeting during the height of this pandemic with Tri-County Health. And whenever I needed to interface with them on behalf of, say, the Gaylord Hotel, in terms of, and much of these regulations that people complained about were from CDPHE. And Tri-County Health simply had to meet that as a minimum requirement. And then, of course, had the option to go above that. But, so there oftentimes wasn't a lot of discretion. They also, it's amazing how we all grew through this process. And they understood as they went forward the need to allow for county differences, to reflect the political culture of the respective counties that they represented from a public health standpoint. And I appreciated that. And I think that there are avenues for reform. They can certainly in working with us accommodate the specific interest of counties. But I do hope that Arapahoe and Adams County can stay together in some type of organization going forward that is centered on Tri-County Health. I don't know anybody in my public life, which is very long, who has worked harder than Dr. John Douglas throughout this entire process. I mean, I always had access to him in talking about when there would be a rule. I said, look, there's this class of businesses that really doesn't quite fit in this, or this specific business, they ought to have a waiver. He wouldn't necessarily always agree with me, but he would always listen to me. And let me tell you, that is not all that you know, I wish I could say that was often the case in American government, but it's not. And so,
Mayor, if you could kind of wind it up,
okay.
please.
Thank you very much. I certainly hope that we can work together and we can stay in some modified version of Tri-County Health going forward and not fragment the city of Aurora into 3 different health departments. Thank you.
Thank you, Mayor. All right, I guess now it's my turn to speak. I've been working with Tri-County for 9 years as a county commissioner. And I can honestly say that during once a year, the counties would get together and we would have conversations about our budget and where that money is going to go. And those conversations were painful, very, very painful for me, because of the simple fact that Arapahoe County had financial restrictions. Douglas County didn't necessarily align with us politically. We had hard conversations about family planning. We had hard conversations about a number of things. Mental health was our latest, hardest conversation of, are we going to fund mental health? Now, these conversations we shouldn't have to have because of other counties' influences. We had, when we were going through our gas and oil regulations, we wanted our health department to come forward to tell us what the health problems were regarding drilling. And Tri-County chose not to because Arapahoe County and Douglas County were against the regulations. And that's how politics was influencing our health department. And that's what was so hard for me. I will be supporting this resolution, and it's not because people are coming in front of me, you know, trying to bully us in this decision. It has nothing to do with that at all. It is simply the fact that we need to focus our public health on the citizens of Adams County. We have unique challenges. We have very unique challenges. There's no secret that we have heavy industrial sites in neighborhoods. Our childhood poverty is at 40% in Adams County. We need to start focusing on Adams County, and we need to provide funding for the things that our citizens need in Adams County. It shouldn't be influenced by another county. It shouldn't be influenced by another county's financial restrictions. It shouldn't be influenced by another county's political leanings. We were voted here as commissioners to represent Adams County, and I believe that we should be able to stand a public health department that represents Adams County. Now, for the next year, Tri-County is still going to be our health department, and their health orders will stand. It's by state statute that when the health department makes health orders, that we have to follow those health orders. The 5 of us can't change those health orders. It's in the state statute. If you want to change that, I would suggest you talk to your state legislators to try to get that changed. But that's not going to happen here in this chamber. So with that said, I'm going to go ahead and ask Erica, let's go ahead and do our vote. Oh, a motion, yes. Okay, yeah. Do I have a motion?
Madam Chair, I move to approve the resolution 21-872, a resolution approving Adams County's withdrawal from Tri-County Health Department.
Do I have a second?
I'll second that, thank you.
Now, thanks, Erica. The motion is passed. All right, County Manager, what do you have for us next?
The next item before you, hold on, is actually the 2021 Commissioner Redistricting, and I believe Jen Rutter will be presenting this item. And Jen, correct me if I'm wrong, there's no action the board needs to take today, so this is just informational.
Yes, that's correct. So good morning, Commissioners. Jen Rutter, Development Services Manager. I have another fun topic for you this morning. I'm here to present the first public hearing for the 2021 Adams County Commissioner Redistricting. Whoops. You click it? Thank you. Thank you. All right. State law requires new district boundaries to be drawn after every U.S. Census, the last occurring in 2020. Adams County's population grew 17% over 10 years to over 500,000 people. There are 5 commissioner districts in Adams County, and each district must represent an equal population within 5%. 5 district map boundary alternatives were created using the following goals: keeping communities whole, compactness, current voter precincts remain whole. Staff held 6 public meetings to solicit feedback over the month of October, 5 in person and 1 virtual. So I'm going to try to go through these as relatively quickly as possible, but we developed 5 scenarios. Scenarios A, B, and E are based on census block populations. Blocks are the smallest geographic area provided by the census, and they are provided every 10 years. Scenarios C and D are based on census block group populations. Block groups contain multiple blocks and are the smallest geographic area provided for population estimates between census years. Creating commissioner districts based on block groups could be helpful in estimating commissioner district populations between the census years. So scenario A has similar boundaries as the current map of commissioner districts, and it was based on census block populations. Scenario B has more alignment with the city boundaries and was based on census block populations as well. Scenario C has similar boundaries as the current commissioner map and based on census block group populations. Scenario D improves compactness and is based on census block group populations as well. And scenario E was based on a little bit more staff analysis after the first 4 were created. It improves compactness and takes into account future growth and is also based on census block populations. So again, staff held 6 meetings, 1 in each commissioner district and 1 virtual so that other interested parties may attend. We only received 1 person that attended one of the meetings, and they just wanted to learn a little bit more about the maps. The public meetings were held through the month of October, and this is the first public hearing in the redistricting process in which staff is required to present the alternative maps. Staff will be presenting this information to Planning Commission in a study session this Thursday at 5:30 p.m. We will continue to collect public feedback on the alternative maps through the month of November. And on December 7th, the second public hearing will be held to choose a new map of the commissioner district boundaries. And I have the team here that has been involved in the process, and we're available to answer any questions.
Questions, Commissioners? Commissioner Pinter?
Thank you so much. The one thing I would like to ask, and it's, I know the answer, that while the district maps are important, all the commissioners are elected at large. And I just want to name that. So
that is correct.
Okay, great. Thank you.
Commissioner Tedesco?
So I have a question about, do any of these maps push a commissioner out of their current district? And 2, what is the guidelines if a commissioner is pushed out of a district? I'll just wait for those 2.
Sure. So none of these maps push any current commissioners out of their current districts. And I don't know if Christy wants to answer the second question.
Good morning, Commissioners. So for the second question, if a commissioner through this redistricting process is pushed out of their district, they are allowed to finish out their current term in that district.
Okay, thank you.
In other words, we have to be nice to each other, or we might be pushing somebody off. the island.
You said none of these maps push anybody up?
No, these maps do not.
I guess I'm curious because I saw one of the maps and it almost seems like you have both Commissioner Odorizio and I in the same district.
Maybe I don't know your home address as well as I thought I did.
Wow. Which map was that? E? I was wondering about that.
Because it goes all the way up to I-25 and he lives east of I-25.
So I can have.
Argue about where he lives.
Commissioners, I think I might be able to answer this. Christy just reminded me that that's not one of the issues that the committee can consider when putting together proposed maps. So it is possible that that did happen because staff was not specifically looking at your addresses when putting together proposed maps.
So hence the question, and I appreciate that it was an oversight, but I was concerned that, you know, you said we weren't being placed in a different district when we actually are. And so that does two things when we, and I heard the one answer for the one, which is if you're pushed out of your district, you get to finish your term, right? But you have other commissioners that are still within their term limits and have to run for a new district if they get pushed out of a other district. And then that creates a vacancy in the other district. So how is that addressed?
So if I may, I have someone here who helped create the maps. So Rochelle, if you don't mind, do you know the answer? You'd have to come up. Sorry.
So if I might, these are questions that I have on the maps that you have. So I know that this is just a presentation. So an answer and clarification right now is not required from me. But please, if you can, when we have this discussion, be able to research, give us some answers, give us some insight, because it is very much pertinent to which map we decide on. Because I want to make sure, I'm term limited, so, but I want to make sure that the other commissioners know exactly what's going to happen, how they're going to, you know, or if they're pushed into another district, do all of a sudden their term limits restart because they're not 3 terms in a term. I just want those questions answered. And I want to make sure that we're all on the same page, so when we're considering these maps, we're not disillusioned, oh, I didn't know that.
So we'll come back to you with those specifics and those answers. Does that sound good?
I apologize. I don't want an off-the-cuff response. I want somebody to actually say, this is what the answer is.
Good catch, Commissioner Tedesco. When I looked at him, when I looked at him yesterday, I didn't notice. Commissioner Odorizio, do you have comments?
No, thank you. I appreciate it, Madam Chair. I think each of these maps has probably some pros and cons, and I think one of the things that we'll have to ask is what is the overall impact of these different maps, and I think that by drilling down into some of these questions, which is part of the process, right? There's a reason why this is a lengthy process with a long stakeholder, very public and lengthy stakeholder process, so I look forward to finding those answers to some of these questions, and I might even ask a few more, but I think that we can do that during the stakeholder process. So I appreciate the work of staff, and I appreciate the work of our commissioners to look at this diligently. That's all.
So, County Manager, we're not going to see this again until December 7th, am I right?
That is correct.
Is it possible we could have a study session before December 7th, so that way the commissioners' questions can get answered?
Absolutely.
Great, thank you. All right. Thank you, Jen. Appreciate it. Didn't know we were voting Odorizio off the island.
That's right. Your opportunity.
Yeah, I was putting him on your island, yes. Not that that would be a problem. All right. Is there anything else, County Manager?
No other new business. Thank you.
Okay, thank you. County Attorney, what do you have for us?
Good morning, Commissioners. If I may beg for the opportunity to make a statement before I move on. I wanted to thank the staff that worked so hard on the Board of Equalization process this year. You just approved the final appeal results that went through the Board of Equalization process and went through independent arbiters to make those decisions. But this is a huge, cumbersome process that staff undertakes every year. This is the task of the county attorney's office, and we have a new employee this year who started with us during COVID, Christina Pazuelos, that just knocked it out of the park. She did such a fantastic job and got over almost 600 hearings scheduled in a matter of a couple weeks. They processed over 2,700 account appeals. The assessor's office also works incredibly hard on this. All of their appraisers have to attend these meetings and have to weigh in on each of those accounts. And then I also wanted to give a shout out to Megan Bennett in IT, who helps us make all of this possible on the back end, on the IT end. So just wanted to give a shout out to that team for working so hard and getting this done smoothly this year.
Absolutely, thank you.
And then on my agenda today is the resolution approving the Colorado Opioid Settlement Memorandum of Understanding, subdivision settlement participation forms, and Colorado subdivision escrow agreements. So as the board is aware, a few years ago we actually joined a coalition of local governments and hired a national law firm and joined the federal multi-district litigation pending against opioid manufacturers and distributors. As part of that process, in that multi-district litigation at the federal level, the many plaintiffs' attorneys and defense attorneys from across the country have worked out proposed settlements with many of the parties at this point. Some are still pending. The larger one is before you, and part of getting the most out of this settlement was having the state as a whole enter into a settlement agreement so that we could gather as much for the state of Colorado as possible. The Attorney General's office led the process to get all of the local governments on board with a flow through in terms of how those settlement funds will be used, the means that they can be used, and how much goes to local government. We, as the local coalition, fought hard to keep most of those funds at the local government level, and I think that we've come to a very good conclusion that will benefit Adams County and our local governments and allow us to actually do something meaningful with these settlement funds. So at the recommendation of our outside counsel, Keller Rohrbach, and our office, we would recommend that we enter into this settlement agreement and the memorandum of understanding with the state.
Okay, great. Commissioners, any questions? I don't see any questions. Basically, I want to thank Commissioner Odoricio, who also worked extremely hard on this and attended I think a zillion meetings, so thank you, Commissioner Odoricio, for bringing us here to this point. And with that said, do I have a motion? Oh, Commissioner Tedesco.
Sorry, I was slow pushing the button.
Yeah, you are.
But I just wanted to echo your remarks. You know, I don't think people really realize how much work went into this over years. I remember talking to Commissioner Odoricio a while back, and he tried to get me to go with him to some of these meetings. I will tell you that he has worked tirelessly to get us to this point, and he has been in front of everybody that you can imagine to be in front of. He's helped outline this, design this, put it on the table for the best use of our county and others, especially throughout the state. And without his expertise and his knowledge in this, I don't know that we would have a product as meaningful and well thought out as what we have right now. So I know there's others that have been just as important in this, but as a county commissioner not involved in it, what I see on a daily basis is the work that Commissioner Odoricio did, and I want to commend him for that.
Thank you. Commissioner Odoricio.
Well, now you guys can tell me. I just want to thank everyone for this. This is just this is just another step towards trying to address addiction in our communities, and it faces. I can imagine that every single person in this room has had a loved one that has struggled with some sort of addiction, or struggled with some overdose, or lost people. And so it was really Jeremiah Lindman came to us about 6 years ago, and he's one of our constituents, and met with Eva Henry at the time and explained how he lost his brother to overdose. And it was at that time we were talking to Chaz and Eva, and we all supported trying to do more. And Tri-County Health did step up and help us, and they created the overdose task force. And I anticipate that those efforts and those collaborations should continue with folks in the metro area in collaboration with Arapahoe and Douglas. So I want to thank those folks. I want to thank Jeremiah Lemon for getting this started in Adams County. I want to thank the commissioners along the way. Every single commissioner who's jumped on this board has been supportive of this effort. You guys give me too much credit. So thank you. I'll be going to a funeral this Friday of a family member who passed and struggled with addiction. So this is pretty personal for me, and I appreciate everyone's support. So thank you.
Thank you, Commissioner. Okay, do we have a motion?
I'll make a motion to adopt.
Okay, do I have a second?
Second.
It doesn't like you. All right, motion is passed.
Okay, Commissioners, I also have 2 executive sessions today. One is on the agenda. It's a motion to adjourn into executive session pursuant to Colorado Revised Statute 24-64024E for the purpose of instructing negotiators regarding an economic incentive.
Do I have a motion? Do I have a second?
Okay, and then the other is an executive session as time allows today pursuant to Colorado Revised Statute 24-64024B for the purpose of receiving legal advice regarding potential litigation.
Do I have a motion?
So moved.
Do I have a second? All right,
And that's it for me. Thank
that
you.
has passed. Okay. We have land use today. So we'll go ahead and we'll take probably a 10-minute break. We'll start at 10:50 for land use.
All right, we'll go ahead and start our land use meeting. Oh, it's the microphone up there. Yeah. Welcome.
Thanks. All right. Good morning, Commissioners. My name is Greg Barnes. I'm with the Adams County Community and Economic Development Department, and today's first land use case is a rezoning application that I'll be presenting to you. It's known as the 3220 West 55th Place rezoning, but the site's actually just west of that address. And this doesn't work. Can I get someone to advance my slides? I need a new battery. All right, sorry about that. So this request is on 4/10 of an acre. That's about 17,000 square feet. And the request is to rezone a property from residential 1C to residential 3. And a little background on this. This 4/10 of an acre is actually planned to be combined with 8/10 of an acre, which is located directly to the east of it. The applicant wants to combine the two properties to make a 1.2 acre development for townhouses on a single lot. And so the need for the rezoning would have a consistent zone district throughout the newly created lot. The site shown here in the center of the screen is located on the south side of West 55th Place. And for context, that is east of Lowell Boulevard and west of Federal Boulevard. Off in the lower right-hand corner of the screen, you'll see the city of Denver. That's where Regis University is located. The site is currently vacant. There's nothing on this site. And the hatched line located to the east is the property which it is being combined with through a plat correction process. Staff has approved that plat correction. It's just waiting to be recorded depending upon the decision made for this rezoning. So the site itself would be 1.2 acres, but the rezoning is specific to the 4/10 of an acre on the west side. The current zoning on this lot is R1C. That's a single-family residential zone district. And the future zoning, if approved, would be R3 on this site. The county's comprehensive plan has designated a future land use of urban residential in this area, and that's where the county would like to see land uses that support residential development at urban densities. The development standards does list specific criteria of approval for a rezoning application. There are 4. One is consistency with the county's comprehensive plan, consistency with the purpose of our development standards and regulations, compliance with the zone district standards specific for what is being requested, and finally that there's compatibility and harmony to the surrounding area. The applicant did provide a concept of what their design could look like. This is just a concept. Engineering drawings and formal submittal of a site plan would be required with a building permit process later on if this rezoning is approved. And as you can see from this red line, the red line shown here is where this rezoning is located. So it's important to note that the applicant without this rezoning could still develop the property that is to the east, and they would be allowed to have up to 11 units on that property, regardless of the outcome of this case. So I did mention the applicant intends for these townhouses to be on a single lot. The development standards for the R3 zone district requires 9,500 square feet per 3 dwellings. If the applicant did later on plan to create individual lots for these townhouses, they could do that through a subdivision process, and the minimum standards for that scenario would be 2,500 square feet per dwelling. The applicant does conform to all of the standards for the R3 zone district. Once the plat correction is approved, it will comply with the lot width for the zone district as well. So for compatibility, I included the aerial photo. There is currently a multifamily development on the property to the east, which it is being combined with. In addition, there's a mobile home park to the north that has a density that would exceed what the applicant is proposing as well. A few pictures of the site to show you what it looks like. This is looking to the interior of the site that is being requested to be rezoned. It is currently vacant. Looking eastbound on West 55th Place, the site is on the right side of the screen. And then looking westbound, the site is on the left side of the screen. There's a utility substation off on the north side of West 55th and single-family residential directly to the west as well. And then just a few pictures to show you what it looks like across the street. So this is looking toward the substation, and this is looking toward the mobile home park from the site. During the referral period, staff notified all property owners and residents within 750 feet of this site. There were 371 notices sent on this particular case. We received 2 comments. One comment was in opposition of the rezoning, citing an increase in traffic and density being undesirable in the area. The second letter initially had opposition. However, through working with the applicant, they ended with support of the application, stating that they were happy with the applicant's concept. We did send it out to referral agencies. We did receive initial opposition from the Adams County Sheriff's Office, citing an increased need for demand of services. That opposition has since been rescinded. I spoke with the sheriff today, and they changed the opinion on this case based on recent funding promises. And the Planning Commission heard this case on September 23rd. The applicant was present and provided a presentation. There was one member of the public who had concern about the water supply in the area, and that member was informed that the applicant does have adequate water supply, and that would be provided by Denver Water. The Planning Commission did have some concern about the sheriff's opposition, but that issue has now been resolved. And the Planning Commission recommended approval of the rezoning application with 4 findings of fact and 2 notes. The staff recommendation before you is 4 findings of fact and 1 note. And the second note that has been removed was just that the plat correction will be approved and recorded by the county prior to approval. And it has been approved. We're just waiting on recording at the conclusion of this hearing. So that concludes the staff presentation. I'm available if you have any questions. Thank you.
Commissioners, do you have any questions for staff? Commissioner O'Dorisio.
Just a clarification for staff, or from staff. You said that if this goes through, the use by right will be R3, meaning the use by right will be higher density residential, and that the lot could be subdivided for townhomes through a subdivision process. Is that the public process or the administrative subdivision process?
It would be a public process. So if the applicant wanted to, after combining into a 1.2 acre, if the applicant wanted each townhouse to be on their individual lot, they would go through a subdivision process which would be approved by this board. The only other option that could be available could be condominium platting, which is more of a legal process. It wouldn't be a formal subdivision, but each townhouse owner would own the structure, and the land itself would be owned and maintained by the group as a whole.
Is that different than how duplexes are done?
Duplexes could go through that same process if they wanted to.
All right, thank you very much.
Okay, any other questions for staff? Okay, I don't see any questions for staff. Would the applicant like to come forward and speak?
The mouse might work.
It might work?
I just plugged it in. So.
Oh, okay.
That was the problem.
Oh, good. Good morning, Commissioners. My name is Carrie McCool with McCool Development Solutions. We're urban planners. Our office is at 4383 Tennyson Street in Denver. We have our team with us here today. We have Bruce Roscoe with Roscoe Engineering. He's our civil engineer in the project. And we also have the owner, Scott Ryapel, joining us this morning. So we're respectfully requesting a rezoning from R1C in it's the western portion of the 2 lots that Mr. Ryapel owns, and it's roughly 17,000 square feet, and we're requesting rezoning to R3. Mr. Barnes did a great job at providing an overview of existing conditions. The fourplex that is on the west side of the lot It is, God, I can't even read that far. It's like 35,000 square feet, and the majority of that lot is vacant. And there are 2 separate lots right now, and we have secured approval to vacate that lot line. And the end goal is to develop the whole property for townhome development. And once the lot line vacation would be removed, the total site would be 1.2 acres. Again, the surrounding land uses are pretty diverse. There's a lot of mix of residential uses, multifamily, single family and mobile home park, and there is also, as Mr. Barnes indicated, the utility station that's to the north. Oops. Let's see if I can get this mouse to work properly. Good job. So when we started this process, the first thing that we did was we reached out to the neighbors. We hosted a neighborhood meeting in June of 2020. There were about 11 neighbors that came in attendance. And at that meeting, we presented a conceptual site plan that was very, very conceptual in nature. And we had originally proposed to keep the existing fourplex. And we identified some surface parking and some building footprints of where potential multifamily could be located on the property. And we did that intentionally because we really wanted to hear from the neighbors on what they would like to see there, what unit types and those types of things. So we talked a lot about the types of units, densities, affordability of the units came up as well, building heights, traffic, property values, and the overall site conditions. We did receive 2 letters in opposition initially, but we've continued to work with the neighbors. And as Mr. Barnes pointed out, one of those neighbors did submit a letter of support that we were really pleased to see, and he found the revised plan will provide needed housing density, and he's really looking forward to growth in the neighborhood. So we took that input from the neighbors, and we really fleshed out our rezoning conceptual site plan. And you would think a lot of the drivers would be the R1 zone district or R3 zone district standards, but it really is a function of utilities. So we worked with Denver Water and the sanitation department to lay out the utilities. We landed on considering townhome development, looking at units that could have parking tucked under the units. And so that would allow us to provide 39 parking spaces on site, with about 5 of them, parking spaces would be surface parking spots for guests, and 1 would be ADA. And then we're also looking at having a landscape buffer around the perimeter on the east and the west and on the south for landscaping, and about 43% right now with this conceptual site design would be accommodated. And so with that, it has been an absolute pleasure working with your staff through the process, and we can totally concur with the findings in the staff report. We appreciate the Planning Commission's input and their recommendation for approval. And so we find we're also in conformance with the comprehensive plan and all of the rules and regulations set forth in the Adams County zoning resolution, and we've demonstrated compatibility with the surrounding neighborhood. And with that, we are requesting your approval, and I'm happy to answer any questions that you may have.
Commissioners, do you have any questions for the applicant? I don't see any. Thank you. Is there anyone in the audience for public comment that would like to speak? Don't see anyone rushing down, so I guess, do we have a motion, commissioners? Yes, Commissioner.
I move for the approval of RCU 2020-00033. That's at address 3220 West 55th Place rezone, and this is with 4 findings of fact and 1 note.
Do I have a second?
Second.
Great. Thank you. It's been approved. All right. What else do you have, staff?
Thank you, Madam Chair. Good morning, Commissioners. Nick Eagleson with the Community and Economic Development Department. And I'll be presenting the Adams County Parks and Open Space text amendments. And this is case number PLN 2021-9. So this request is for text amendments to modify the Adams County Development Standards and Regulations. Just a little bit of background. So this was really the result of having a better understanding of our neighborhood parks and regional parks throughout the county, and what uses would be most appropriate for those parks, again, throughout the county. We started this process in the fall of 2020. That's when we also started our stakeholder outreach. In January of 2021, staff met with the Board of County Commissioners to discuss the overall timeline and process. In June of this year, we reviewed the final draft and made revisions to the code language. In August, staff met again with the Board of County Commissioners as well as Planning Commission to look at that timeline and discuss the overall topics. And that's we also held in August our public and additional stakeholder meetings as well. So looking at the project purpose, this was really to review the current and future uses in the parks and open space throughout Adams County, creating parks and open space zone districts that would help better address those different types of land uses, updating parks performance criteria as well as our performance, our agriculture performance criteria, and then also addressing temporary and special uses through the park zone districts. So some of the proposed changes were to create 3 open space categories. Those would include neighborhood park, regional park, and natural area. Also looking at existing as well as new uses and if those would be permitted, conditional, or prohibited. Also creating new dimensional requirements as well as additional definitions. So within Chapter 3, the first zone district would be neighborhood park, and this really focuses on open space, park, and recreational uses that would be compatible in a residential or mixed-use setting, having active and passive recreational uses that would be permitted, and then also neighborhood parks would be owned and operated by a public or quasi-public park, open space, or recreation district. And then next would be our regional park. This would provide facilities as well as recreational amenities for really a broader area that would draw in users from around that region. Some of those uses that would be appropriate in this zone district would include fairgrounds, agricultural demonstration areas, agritourism uses, and cultural and educational uses. And this also may protect the large areas with natural resource value as well as overall regional importance. And then the last one would be natural area, and this one would provide for the preservation of open space and critical natural areas. Lot sizes in this zone district could vary for things like effective water conservation, land preservation, and protection of the environment and wildlife. Development and active uses would be limited as well in this zone district. So this is just a look at our use category for recreational uses that was created and also consolidated some of those recreational uses. We also defined some new uses such as zoos, aquarium, agritainment, and educational tours. And here's a few performance standards that were added within Chapter 4. The first one being educational tours, and that those would be, the incidental use would be clearly incidental and secondary to that parcel. It could include activities like tours being conducted by foot or by tractor. Also, employees on site would be, it would be completed by staff working on those parcels or outside agencies. No outdoor storage would be allowed. And then another one would be agritourism. For this incidental use, it shall not change the character of that parcel. Again, they could do tours that could be conducted by staff or outside groups. No outdoor storage would be allowed. And then lastly would be animal-related uses, and this would require that property owners who develop near existing parks would need to maintain that landscape character of the existing park use. We would also have minimum lot size requirements for things like aquarium and botanical gardens, wildlife preserves and zoos, and again, no outdoor storage or offensive impacts. So here's just several definitions that were added to Chapter 11. Those would include recreational uses, agri-tainment, educational tours, incidental sales, indoor and outdoor recreation, and public recreation center. So throughout this entire process, we've had a lot of stakeholder outreach that included Adams County Parks Open Space and our Cultural Arts Department, Adams County Special Events staff, Highland Hills Park and Rec, Splendid Valley District Plan Commission, and the Strasburg Park and Recreation. And as I mentioned earlier, we did have our final public outreach meeting that was held on August 10th. This did go before Planning Commission at a hearing on October 14th, and Planning Commission voted to recommend approval of 6-0 with a condition that the following be modified. The first one was that pool arcade and video game arcade uses in the Regional Park Zone District, they were separate uses. They thought it would be more appropriate to have those just be under the same use category and have those be permitted in that Regional Park Zone District. And then the second one was having a maximum floor area for a recreation center in the Neighborhood Park Zone District. There was nothing proposed, and they felt that it would be appropriate to add a maximum floor area for that. Staff worked with Parks on what an appropriate number would be. So we've added 175,000 square feet within the text amendments. So staff is recommending approval of the text amendments based on 3 findings of fact and 1 condition. And here are the 3 findings of fact. They are that the text amendment is consistent with the Adams County Comprehensive Plan, that the text amendment is consistent with the purposes of these standards and regulations, and that the text amendment will not be detrimental to the majority of persons or property in the surrounding areas, nor to the community in general. With that, staff will be happy to answer any questions. Thank you.
Commissioners, do you have any questions for staff? Okay, I don't see any questions. Do I have a motion? Oh, public comment. Is there anyone in the public that needs to comment? And I see 7 people in the audience, all employed by Adams County. So thank you guys for hanging in there for us. I don't see any public coming forward. Commissioners, do I have a motion?
Madam Chair?
Yes, Commissioner.
I want to thank staff for working on this. You guys are doing a lot of work right now. You're raising the bar everywhere in the county. I appreciate that. You guys are working hard with stakeholders. You're listening to folks. And this is just one more milestone and accomplishment. And I want to thank you for what you're doing. So thank you very much. It's with that I will move to approve this text amendment PLN 2021-00009 based on 3 findings of fact and 1 condition.
Do I have a second?
Yes, I'd like to second that. I would also like to thank the Parks Department for consistently reviewing text amendments, the text language, to modify them to current and future needs, and to address citizens' concerns in some of those regional park and community park areas.
Great, thank you. Motion is passed. Thank you, everybody. So that is it for today's public hearings and land use. It is 11:15, and we'll go ahead and adjourn and reconvene in the study session room.